All right, welcome to the Memorizing Pharmacology podcast, episode 34. What we're going to do is we're just going to talk about side effects. In this case, it's gynecomastia because we're talking about something that is related to some of the GI drugs, but also other classes of drugs. So again, if you're trying to remember a lot of things about side effects or a lot of things about a specific drug class, sometimes these types of mnemonics or advanced mnemonics are the best way to go. So I'll get started again with the mnemonic itself. We'll let that play, and then we'll go do a little bit of quizzing, just a couple questions to make sure you got the concepts.
Question number 3. Name 8 drugs and/or drug classes that might cause gynecomastia. Number 3. Gynecomastia side effect drugs. We'll use the mnemonic female parts care. P. Protease inhibitors. A. Anti-androgens. R. Reverse. T. Transcriptase inhibitors. S. Spironolactone, brand name aldactone. C. Cimetidine, brand name Tagamet. A. Anabolic steroids. R. Risperidone, brand name Risperdal. And E. Estrogens. Quick summary. These drugs can cause gynecomastia, swollen breast tissue in males. Since cimetidine ties to the group of H2 blockers in the slide before, we can now add to our memory other drugs that also cause gynecomastia. If we don't do this, the mnemonic has nothing to connect to and may fade quickly. Anchors and transitions are critical to keeping knowledge glued to your gray matter. To get to the next slide, we think of therapeutic progression. After failing an H2 blocker, one might move on to a proton pump inhibitor, PPI.
Okay, so we'll go to the memorizingpharm.com course. If you, again, want to join the email list, you just kind of go down here. You get the pharmacology cheat sheet with all of those drug suffixes here, and then let's go on to the course. So this is residency.teachable.com, and we're going to go to the self-paced pharmacology course, mobile quizzes and videos, and this is going to be just a couple questions about the mnemonic we just learned about. So you're going to see something more like this, which is which drug causes gynecomastia as a side effect, and you're going to get a list of drugs. And so we kind of go back to our mnemonic, okay, and we see parts care, and we see that, oh yeah, okay, of spironolactone, lisinopril, insulin, or tramadol, of spironolactone, lisinopril, insulin, or tramadol. Which one is it? In this case, it would be spironolactone, which is brand aldactone. And again, on the course, you can just hit check, make sure that you're correct, okay, and then hit continue. Which drug class causes gynecomastia as a side effect? So again, we're going from a specific drug now to a drug class. So is it the diuretics, estrogens, antibiotics, or testosterone? And again, in this case, we're asking for a drug class. So although testosterone is a drug itself, it is not a drug class. Okay, so in this case, we would say the estrogen. So again, be careful. Sometimes there will be some splitting of hairs in that case where, if it had been anabolic steroids, that would have been a drug class, but not a specific drug. That wasn't what the question asked. So estrogens is our answer. We're going to check that one. Yes, that one is correct. And then we kind of move on. So again, if you got questions about this, TonyThePharmacist@gmail.com. Again, just trying to give you a little bit more for whether you're taking the courses or you're doing the books, memorizing pharmacology or memorizing pharmacology mnemonics. All right, see you next week.